Hello everyone, I am Dr. Anil Kamath. I am a senior surgical oncologist here at Helios Cancer Clinic. So let me talk to you all about voice box cancer. So it's a fairly common problem in India. What a layman refers as voice box is an organ in the neck which is responsible for the production of voice. But as an oncologist, there are different subsides of the voice box. We have the upper portion, what is known as supraglottis, the glottis or the actual vocal cord, and the subglottis. So let me talk to you all about these cancers. So what causes these cancers? So like any head and neck cancer, smoking is one of the most important factors which leads to this cancer. Apart from this, males are more susceptible to develop this cancer. Old people are more susceptible. Nowadays there are other risk factors. The upcoming risk factor is HPV infection, what is known as the human papilloma virus, especially the subtypes 16 and 18. Those who consume alcohol with smoking are at more risk to develop this cancer. Those who have reflux symptoms constantly over many years are more susceptible to develop cancers of the voice box. So the symptom usually presents as hoarseness of voice. So if we have an elderly male, especially who is a smoker, who has hoarseness of voice, which say lasts beyond 2 weeks or 3 weeks, he definitely needs to be evaluated by a ENT person with the lookout for vocal cancer, voice box cancer. The other symptoms may be aspiration. So when the patient takes food, he has to cough out. There may be pain in the throat, and in some cases the patient might cough out blood in the sputum. Now once a cancer is suspected, what can be done on the outpatient basis is a laryngoscopy, where a thin lighted tube is put through the nose and the vocal cords and the tumor, if there is there, can be directly seen. So the next step would be to take a biopsy. Take a small piece and send it to the pathologist. The most common type of cancer here is what we call squamous carcinoma. Once the diagnosis is established, the next step is to see how much it has spread. For this we do various investigations like CT scan, MRI, or more recently the PET scan. The treatment, like for any other cancer, will depend on the stage of the disease. A very early cancer, a small cancer on the vocal cord, can be excised by endoscopic method. Sometimes we use lasers to do this sort of excision. Now as the tumor increases in size, then surgery becomes more difficult, because this will mean removing the entire larynx, and that will mean that the patient will have to live with a hole here in his neck, a procedure we call as tracheostomy. So the patient will not be able to speak. To compensate for this, most of the cancers are not treated by surgery. The first choice of treatment in most cases is chemotherapy along with radiation. Radiation plays an important part in the treatment of voice box cancers, and chemotherapy potentiates the effect of radiation. But there are some cases where surgery will still be required. If the voice box is already damaged because of the spread of the cancer, if the cartilages are destroyed, these are the cases where radiation will not work well, and these patients will have to undergo removal of the voice box, a procedure we call as laryngectomy. It is very important to understand the symptoms of voice box cancer so that it's appropriately treated. Thank you.